Assesses need for wound care and verifies order. States expected outcomes. Gathers supplies, bath blankets, sterile gloves, dressing change tray, waterproof pad, discard bag, clean gloves, measuring tape and pen. Perform hand hygiene. Identifies client with ID band using 2 identifiers. Assesses client's level of comfort and need for analgesic prior to performing dressing change. Assesses for allergies to wound cleansing agents or tape. Explain procedure to client and assess understanding. Instruct client not to touch wound area or sterile supplies. Provide privacy. Raise bed to comfortable working height. Position client comfortably, drapes client in exposed wound site. Place waterproof pad under client along or under wound site. Places cuffed trash bag nearby. Dons clean gloves. Gently remove tape from skin by pulling parallel to skin and toward the incision, while holding down the uninjured skin. Gently remove dressing 1 layer at a time, taking care not to dislodge drains or tubes. Keep soiled surface away from client's face. Observe character, color, and amount of drainage on dressing, and then discard. Thoroughly inspect the wound and peri-wound for appearance, size, drainage, edema, approximation, granulation tissue or odor, counts the number of sutures or staples. Folds dressing with drainage contained inside and removes gloves inside out over dressing. Disposes of gloves and soiled dressing in discard bag. Perform hand hygiene. Prepares 3 strips of tape, tabbing the ends. On one strip, writes date, time, and initials. Places dressing change tray on bedside table and opens away from self. Discard or set aside enclosed discard bag. Opens package of sterile gloves in area away from dressing change tray. Applies sterile gloves. Prepares sterile field by laying out blue drape on tabletop. Carefully places inner contents of dressing change tray onto sterile field, and avoid 1-inch non-sterile margins. Opens swab stick package and holds in non-dominant hand. Cleanses incision using separate swab for each cleansing stroke. Swabs down the incision from top to bottom, discard swab. Swabs down the far side of the incision top to bottom, discard swab. Swabs down the near side of the incision top to bottom. Discard swab. Uses 1 or 2 sterile gauze pads to dry wound from top to bottom, holding the corners of the sterile gauze pads with forceps. Discard the gauze and forceps. Covers the incision with the remaining 4x4s without touching the side facing the incision. Covers the 4x4s with topper, abdominal pad. Secures dressing with the prepared tape strips with gentle but even pressure. Removes waterproof pad from the bed. Removes and disposes of gloves. Performs hand hygiene and repositions client for comfort. Disposes of all supplies. May use gloves if necessary. Performs hand hygiene and documents procedure, including client's response and observations, size, drainage, edema, approximation, granulation tissue, odor, condition of surrounding skin, and number of sutures or staples.